Good morning, everyone. Nice Sunday here in Milano, a little windy, but there are some clouds, but the weather is not too bad. Not as in Israel, but not too bad at all. So I've been invited today to share with you my experience with BeautiFill and LipoLife that now dates to 3 years and a half. So my presentation will be a general presentation, then we will go into detail, talking about possibilities and perspectives of this kind of treatment. I really would like this to be interactive if possible. So if you have any question, please don't hesitate to ask and to ask and to make question or to rise up the hands or digit into the platform your questions. So I will start from this is the base. So we know that liposuction is the number one cosmetic surgical procedure around the world. So there is space for everyone to start with. Lipofilling and fat graft is the number 4 procedure worldwide. It means that lipofilling and fat graft is increasing in popularity as crazy in the last years. Then another thing that we have to consider about is buttock augmentation that nowadays in USA is number 8. Okay, we are not the States, we are not South America, we're more conservative, and we are European, so we don't like huge buttocks as the ones in the States or in South America. But anyway, nice buttocks are nice everywhere. Then tissue laxity affects everyone. This is the other consideration that we have to do, and we have to deal with that. And then, last but not least, especially in my in my practice, that is based mainly on breast, genital, and fat grafting, is that breast augmentation is gaining popularity. I'm talking about fat graft breast augmentation. Is not a good moment for the implants since the big story with allergen. So in the last 2 years, the number of my procedures of fat graft for breast increased dramatically. Let's start with LipoLife. Which kind of machine is that? Is this? It has 3 components. The first component is this. This is the heart, is the diet, is 1470 diet. This is the part of the machine that you can take out and you can move. For example, if your machine is based in your office and you want to move to operate in a clinic, what you do, you move the part up, and then you can use whatever you have in the other operating room. Okay, it's much better to have all the platform all together, but in case of emergency, you can use even just this. So this is the infiltration station. It means that this is the pump for the infiltration, and it's high value. I mean, the power of infiltration is extra high, so it can be extra soft. The injection can be extra soft, or it can be really with a high flow. And this, of course, according to your need and what you want to do. For example, you don't want to pump inside the fat huge quantity of saline with high pressure if you want then to harvest the fat, because you want to make a delicate infiltration. While on the other side, if you want to infiltrate huge surface without fat grafting, it's really a matter of minutes. So the system is top. And here you have the aspiration. The aspiration is very good as well, and it goes up to minus 90 bar. So the aspiration is top. But what I wanted to say again about that is that the platform is slim, but anyway it has volume. So
Max,
yes,
just for a second, we just see the first slide. We don't see the other slides.
No, okay, I'm just talking about that. I will change immediately. So what I'm just saying, but if you want then to switch and to move with this, it's easy.
Okay, so we just see the first slide and we're waiting for you to move it to the other slide.
Yeah, but I was staying on this. Okay. Then can you see that? Can you see?
No, we just see the first part, the first slide.
So just my face?
Yes, exactly. Just your.
How is it possible? I'm changing everything. Just a second. Hold on. Because I'm sharing my screen. Do you see that? Amit?
No,
I have my first slide. This is my second one. Do you see it?
No, we cannot. We don't see it.
How is it possible? Just a second.
Now we see. Now we see with the second one.
Something strange. Hold on, just a second, and let's try to fix. Yeah, but it's during the reproduction, but it seems to be something strange. Do you see this?
The second one.
Now you see the third?
No, the second.
Something with the reproduction, I don't understand. Yeah, I know, but it's during the reproduction. I don't.
Maybe reshare it and not the screen, but the presentation file itself. Maybe it will help.
Hold on. I'm sorry, never happened. I do it so many times. You see number one?
No, not yet. We don't see anything right now. Okay, no, not yet. Okay, so now we see the first.
Yeah, okay, but I want to make the presentation. How is it possible? So you see number one. Do you see number two?
No, the first one.
I don't understand.
Oh, now we see the three.
No, yeah, of course, you see the frame, but what happened is that then when I click, okay, when I click on the okay, we will try to do it like this.
Yeah, bigger one would be better.
Yes.
I'm sorry, I don't know. It's a Zoom problem because I did a Zoom yesterday. And everything was perfect. I don't understand. Anyway, so let's go back to the subject. What I said is that I will go briefly. Liposuction, number one procedure. Lipofilling is number 4. Buttock augmentation in the States is number 8. Tissue laxity affects everyone, as I said. So it means that it's very important for us plastic surgeons. So we cannot think about making a liposuction, performing a liposuction, and leaving tissue laxity. And then other thing I was saying is that fat graft breast augmentation is gaining a lot popularity. And what I said is that in the last 2 years, since Allergan story was on the papers, on the journals, I had an incredible increasing of patients coming to me to remove implants and to change implants with fat. Okay, not all patients are suitable for that, but anyway, there is a huge market. So this LipoLife BeautiFill system with the three components. The first component is this, that is the heart of a machine, is a 1470 diode, and this is the infiltration pump. As I said, without an image, but as I said, it's high powerful. It means that you can infiltrate the body really in few minutes. Sometimes you want it, sometimes you don't want it, especially when you want to fat harvest, so you don't want to damage the fat. And on the other side, there is the aspiration system that is, again, is very, very powerful. So you can decide with those system to increase or decrease the power of the aspiration. So if you would like to aspirate with the purpose of fat graft, you will diminish a little bit the power. The power. If you want to aspirate as fast as you want, you just pump up, and you will have a super aspiration. I again want to clarify what I said is that, for example, myself, I have my machine that is in my office. In my office, I have an operating room, but I perform certain kind of operations in my operating room. In other kind of operation, I perform in a clinic, where there are all the everything is the good place where to perform, for example, huge liposuctions. So in this case, instead of moving all the platform, I just move this with me, and I use the pump and the suction system of the clinic. So this is, it's very easy to move, to take out, and to move with it with you. The treatments that you can perform with the system are liposuction, of course, skin tightening. I'm separating liposuction and skin tightening because sometimes you just want to perform the tightening of the skin instead of a suction. Imagine, for example, just laxities with patients with no overweight. You don't want to perform a liposuction. You don't want to lose fat. So you can use just the fiber in order to skin tight. Then fat grafting, of course, and we stay on that a lot. And then combined surgery. Again, another example. Now I cannot even think to perform a breast reduction without fat removal with a LipoLife, because this increases the capability of the tissues of tightening. It means that the external quadrants are reduced with fat graft, but I will show you how. Then the same system has the possibility of the saphenous vein endoluminal treatment. So there are some specific system that you can buy if you are interested. Of course, you need a good and valid vascular surgeon. Then there are the fibers for the axillary hyperhidrosis. That this, I think it will have a real future, because there's plenty of cases and there are really few surgeons that want to treat it properly. And then there is another kit for the turbinates treatment. So this is the platform. There's, you see, this is the pump. So the 1470, the infiltration, and the aspiration system. You see here, this is the solution, the saline, the Klein solution of what you want, that is inserted into the syringe, the pump, and then you will perform the tumescent infiltration. As I said, according to the need and your need, you may inject more or less. And so this is the 1470, the reason of the 1470, and we will talk a lot about this. This the cannula, and the fiber is inserted inside to ensure maximum safe, and the energy is delivered radially. So not frontally, but radially, and this is a grant high safety. So at the same time, you have simultaneous lasing and simultaneous suction of the fat, but the fibers of the fat are kept in their integrity. Then the fat may be passed into a special canister. And what happened to the fibers is this: you harvest the fibers, but the septa, what we call the lockwood septa, are kept in their integrity. So during the healing process, what happened is that we are a subsequent skin tightening. Then the fat that we harvest has a high quality and vitality range that can be used for fat grafting of the face, of the buttocks, of the breast, or where you feel more comfortable. Then the tip of a cannula is specially designed, and there is a thermometer, so you know exactly every time the temperature of the tip. And what happens, what we said, with the contraction of the collagen fibers and the stimulation of new collagen. So according to the need, what we have is an aspiration system, or a tightening system, or a simultaneous liposuction, skin tightening, and fat grafting system. So high-tech liposuction. Let's go with an overview, because as you know, and as we know, LipoLife is not the only system on the market. So I would like to share with you some of my thoughts. Historically, liposuction dates back to 1926. And you know that from the 60s to the 70s to Fischer, the Italian Fischer, Fischer was a plastic surgeon from Rome, that developed the technique at the same time as Illouz did. And then just in '92, there were the first machine that was a laser liposculpture machine but with a very high complication rate. And then by the time the tumescent gained popularity in '85, and the ultrasonic was on the market in '87. So first the ultrasonic in '87, and then the laser in '92. And it gained popularity, the laser, for some years, but then it was quite abandoned due to the complications that were seen. Classic liposuction has huge advantages. The classics are cheap, fast, 40 years of experience, I would say 80 years of experience. On the other side, is quite aggressive on tissue and no tightening effect, or no tightening effect. And the cell viability compared to LipoLife is definitely less. Then stress and strain for operating hands, and non-selective. But anyway, it's still a golden standard. I think that classic liposuction is, if performed properly, is a great procedure. Then there is the PAL on the market. Again, I use it so many times, and I always thought that the biggest disadvantage is weight of the system, that is noisy, and the vibration on my hands were quite frustrating. And then there is no selection of the fat harvest that you are harvesting. Then there is the water-assisted liposuction, and each of us has specific considerations and prefer one technique or the other. I don't like, for example, ultra wet tissues because I cannot be precise in what I'm doing. I always try to inject what I need in order to not to have bleeding, but I don't like to over wet. And when you perform the WA, the water assisted liposuction, you have to over wet, and then of course there is no tightening effect. So I think that the system for itself, it's a great system for obese patients when you have to perform mega liposuction, but nowadays are really few because we know the risk. But I think that in this case, the system is a good system. Then there is ultrasound assisted liposuction that I use for years. I think that is great. It's a great system, a great concept, and it's fantastic, very fantastic machines. But there are some but, as you know, the machines. I think that the pros are the tightening effect, and the studies, because there are many studies about the WA, about a kind of WA. On the other side, there is indiscriminating thermal technology that can cause burns. But this is one of the main problem of the WA, and the cell viability compared to the LipoLife is little lower, not too much, but it's a little lower. There is the low aspiration rate, is very expensive, and is low tech because you cannot perform at the same time suction, procedure and suction. So you have to do it. It takes definitely more time to perform it. Then there is the RAL, that is radio frequency assisted liposuction, but it's totally different in this case because we are not talking about fat harvesting. We are talking just about the tightening effect. And if we're talking about tightening effect, I think that there are some machines that can work quite well. The price is definitely moderate compared to the price of LipoLife, but on the other side, no fat harvest, so it's something different. You cannot harvest the fat. You cannot have fat to inject. So there is a huge limitation on that. And I would not consider a machine like that in my practice. I mean, too limited. I would not pay $40,000-$50,000 for a machine that I can use just for tightening if I can do exactly the same with another system that allows me to fat harvest as well. Then there is the LAL, laser assisted liposuction. As we said, it's on the market since '92, but for many years it had some popularity. Then it dropped down dramatically, especially because the CO2 liposuction machines were from one side extremely effective, from the other side the complication rate was so high that it was abandoned by majority of surgeons. But why then Alma decided to go on 1470 wavelength? Because the wavelength made completely different one system from the other. 1470 is a special wavelength where, because it's less absorbative in fat and more absorbative in water. What does it mean this? It means that when you harvest the fat, the only cells that you harvest are the fat cells, but all those fibers are kept in the integrity, in total integrity, because it's extra gentle on adipocytes. You can clearly see in the fat that you harvest. I invite you to take some fat with LipoLife and give a preparation to a cell lab and to make a count of the cells and a viability study. You will be impressed by the high viability of the cells. What else happened with the 1470 is that it stimulates those fibers that are the fibers that were described by Ted Lockwood in the 80s, and are the septa that keep the fat inside the tissue. So it stimulates those fibers and it helps to shrink. Okay. Then there is another effect that we are studying now that is very interesting for fat grafter, that is the stimulation of the stroma, because the percentage not only of giant mature adipocytes, but the percentage of cells of the stromal vascular fraction is extra high. It seems that it is like having a tree of apple, and you shake the apple, the tree, and you get mature apples and unmature apples. So what you have in your canister are cells that are from one side giant mature adipocytes, and from the other one are stromal vascular fraction cells. The comparison of bare fibers and confined fibers is this, and is extra clear. The fiber of the LipoLife is confined inside the cannula, so the possibility of damaging tissues or burning tissues is so rare. If you consider a bare fiber, but it means that you have energy that is on the tip, then it is clear that you can deliver the energy on the tip, and if you concentrate all the energy here, the thermal injury may be very, very high. Of course, sometimes you want a bare fiber, and you can have bare fibers for LipoLife, but in the majority of cases, you don't need it, and you need something that is extra safe. Then if we make a comparison of the technique on the systems on the market, of course, I always like to share, because if we cannot say that LipoLife is the only system on the market. I think in my choice 3 years ago, after a comparison of all the machines of the market, went on the LipoLife. But of course, there are many others. Some have some benefits, some others have no benefit at all, or they cannot be compared. For example, we cannot compare LipoLife with a radio frequency, because with radio frequency, the only thing that we get, that is important, but the only thing that we get is skin tightening. So you see here, skin tightening is okay. No way. It's a wonderful system for skin tightening. Then if you think about just the CO2 systems, laser systems, you have no fat harvesting. I mean, you have to proceed firstly with the fibers and then fat harvesting. So it's a double time, and then it's a bare system. So is not I don't think that is as safe as we said. The mechanical system, vibrating system are very interesting systems, but first of all, the fat viability is not the same. And the skin tightening, of course, with our system we have it, and with the other system we have definitely less. So it always depends on what you're looking for. If you're looking for a cheap system, don't buy LipoLife. If you're looking for something extra easy to use, don't buy it. If you look for something extra small, don't buy it. But if you're looking for something that is for a machine that is extra effective for liposuction, for skin tightening, alone or in combination for fat grafting, I think that is the perfect machine. It depends on what you look for. Let's go with some examples. So then you start with, in this case, we start with infiltration. So you see the pump, the infiltration pump. This infiltration pump. Not speed it up. trying to speed it up, but with this presentation is very hard. Okay, after this, we proceed with fat harvesting. You see here that this is a cannula of 4 millimeter. You have cannulas of 4 and 3 and 2 millimeters according to the need. And you have 2 kinds of fibers that can be inserted inside the system: a 600 nano, a 600 and 400. And the dimension of the 2 is it's different. I start in the deep tissues. I start in the deep tissues, in the deep surface of the tissues, and then slowly I go on the surface in the majority of the cases. In other cases, I perform what we call a superficial liposuction, laser liposuction. It means that I start from the surface and I go more deeply. And this is according to the clinical case and the condition of the tissues. More the energy you deliver, more the retraction that you will get. What I learned in those 3 years of experience is that we don't need sometimes so much energy, and sometimes we can get extra results delivering a good energy, but without being excessive. I saw that in the majority of cases, for example, we really don't need to to deliver really extra energy. Then here in this case, we start with the inner tight. You see the color of the fat is always like this. No way the system allows to reduce the bleeding enormously compared to a normal system, to other systems, and it allows me to treat even those areas that are that before I would never treat with a liposuction. For example, inner tight, hyperlaxity or hyperlaxity of the inner tight, I would never treat it with liposuction. Now I treat, of course, with careful, being extra careful. So you saw on the left side I was performing the fat grafting, the fat harvesting with a 4 millimeter full dip. And here I change the dimension of the cannula. I'm going with a 3 millimeter cannula, and I'm performing the skin tightening only. So I'm delivering the energy under the skin in order to have a better tightening of the skin itself. I would say that it's quite tricky. The tightening procedure is quite tricky because you have to understand how much you're that according to the quantity of saline and solution that you infiltrate, and according to the temperature of a solution that you're infiltrating, you will give more or less tightening, because it will if you, for example, you inject saline, chilled saline, so low temperature saline, then to reach the temperature in order to get a skin tightening, it will take more. If you inject some saline that is room temperature or body temperature, it will be definitely easier. So here I collected my fat and I positioned it into the canisters. This the old canister of Alma. Now Alma has a collection of new canisters that are definitely better than this one and even easier to use. I like to wash the fat with some saline in order to get out of a lidocaine. I don't like lido on my cells because it has been demonstrated that lidocaine can damage the cells themselves. So I always wash a little bit the fat with the. Then fat is harvested and is taken by the canister and then is grafted. A key point is that better the quality, less the quantity, because the fat survival of good quality of fat is definitely higher than the grafting of fat that has no good quality. So good quality, less fat. Bad quality, sometimes you need more, and the complication rate is definitely higher. And I hate complications. I really hate complications. Now here we are on the abdomen. You see the fiber, the cannula. I start harvesting full thickness all along the abdomen, reducing the fat of the abdomen. And the cannula enters really easy. It's like entering in the fat, in the butter with a knife. After that, I'm going with details. I like very much to sculpt the abdomen. The sculpture of the abdomen, both in women and men, I think that it gives very good results, and is really sculpting. Is more sculpting than a simple fat harvesting. So you have to define where you are, what you want to do, and I like to sculpt the midline and then the two lateral lines in the woman. In the men, I will show you briefly what I do. You see here that I'm really superficial. I go superficial and slow, very slow, in order to give more energy, because in this case I want this line to be more deep. This is the case, but this case I operated this case on the Incas, and it's on the it's in Incas Academy, so they took the images, and you see how the quality of the skin improved. Look at the first of all, okay, the quantity of the fat, the shape of the body, but look at the quality of the skin. Look at the quality of the skin. It's definitely better. And I fat grafted here. I fat grafted. I didn't remove fat. I fat grafted. I removed fat here and increased the projection here and here. Look, you see, fat grafting, fat harvesting of this area in order to give a better shape of the flanks, fat grafting to improve the projection of this side, and fat grafting here, little fat grafting here, and here. Again, other case. This is sculpting. I like very much see those shapes that are Mediterranean shapes, but I think that are more sexy than the too much skinny ones. You see, this is fat grafting, fat harvesting here, a little bit here, and then fat grafting. Here you don't need much. We are talking about around 100 cc's per side, but you have to be extra precise on where you inject the fat. Then high definition LipoLife is fantastic. I found it extra useful. See this man, for example, in this case, what my program starting from the thorax was LAL in this area, and submuscular fat graft of the pectoral. Oh yeah, this is the female to male patient, so it's a transsexual, one of my transsexuals. So liposuction, so I have to turn the thorax into a male thorax. So this is LAL of this area to remove the fat that is classic of the woman, and in this area I will go with again with the LAL and with the submuscular fat grafting in order to improve the projection of the muscle. LAL again here, little fat graft here, because this here I perform the bilateral mastectomy, and then I will go on the abdomen with the LAL and fat graft at the same time. So reduction of the fat and injection of the fat inside the muscle with guided ultrasound. And those areas is skin tightening only, skin tightening, fat harvesting and skin tightening. And this is the scar of the hysterectomy, so percutaneous release of the scar and fat graft. Oops, little music, remove the music. So we start with a general fat grafting, fat harvesting of the abdomen. Then, okay, let's go here. So this is the general fat grafting of the full thickness reduction of the fat. And after that, after the reduction, I will go with taking care of the midline. You see those small incisions. Those are the small incisions I will use changing the cannula for the definition of the horizontal lines. So look what I'm doing. I'm very superficial, and see how the midline collapses and reduces. Other cases, LipoLife is wonderful for the treatment of gynecomastia. Because it's very easy to use it through the gland. We know that in gynecomastia there is a component of fat and a component of gland, and due to the energy delivered by the fiber, it's very easy to very easy to harvest the fat and to harvest even the gland. Because if you check of what you harvest, really it's very easy to find lots of glands inside. And then at the end, I always remove a little bit of the gland. But then you can do it really through a very extra small incision and see how there is no bleeding, because now there you find only the gland. There is no fat at all. There is only the gland. I push it and I'm trying to, I pull it out. Look at the quality. Is after the suction is gland only. So there are some fibers and you cut the fibers and slowly, slowly you pull it out. It's like a net. And before you could do it just with definitely a bigger incision. This is a 3 millimeter incision, nothing more. You see, this is all the gland that is coming out from a small incision, but you cannot achieve this without a previous liposuction. Of course, this is a young patient, as you can see, but the results that you can achieve even on elder ones are very interesting, because it's definitely more difficult. It's much easier to achieve a good result with a patient like this than with a patient like this, where there is an extra skin laxity. But see the result even on patient with a skin laxity and with big breast. I found it very, very interesting. Of course, the same system can be used with very good results on the neck. The neck is one of the top treatments for the LipoLife, and you can perform it on the medial section or on the lateral sides as well. And the results are constantly very, very good. But just remember that, okay, so very, very good. So I would say that for the benefits for patients are definitely the better results, because it's a liposculpture and skin tightening, and inelastic tissues can be aspirated, while before I could not do it. Extra low bleeding, no way, very extra low bleeding. Faster procedure, well, in some cases yes, in some no. For the neck is extra fast, but for the other procedures, I'm talking about huge procedures where you really need skin tightening, I would say that is at least at the same time of a regular procedure, but definitely with a better results. And for the surgeon as well, better results, simplify combo procedures because you have a 3-in-1. Faster and less fatigue depends. In some cases, it's definitely faster. In many cases, it's even longer, but I don't care because the results are definitely better. What I understood is that there is a learning curve. You have a Ferrari in your hands, and with a Ferrari, you can go on the motorway at 30 kilometers of speed, or you can press and go at 300. Sometimes you need to go at 300, sometimes you need to stay at 50 or 100. and according to the need and to your skill. And so there is a learning curve. It's quite tricky, but if you understand the machine, you never go back later. I will go now specifically to some themes. Laser-assisted skin tightening, for example. The skin for patients, very safe, very effective on minor and mild relaxation, is effective on major relaxation, efficiency even for laxity treatment as well. I would like to share with you something that clarify exactly the effect, the efficacy of the system. This is labia majora skin tightening. Is labia majora that need to be skin tightened. I don't like to overfill the labia majora with fat, because I found that labia majora, as the face, cannot be puffy like this. It has to be more tightened than puffy. See what happened when I use the fiber under the skin of labia majora on the dartos. Look at the effect. You see clearly the tightening of the tissues. You can see it very, very clear. Of course, you have to know exactly the energy that has to be delivered, but look at the shrinkage of the tissues. Look, I'm under the skin, I deliver my energy. Look at the shrinkage. So then I, of course, first of all, I treat the labia majora with a LipoLife. Then I go with a CO2 pixel laser resurfacing to get more skin retraction from the surface to deep. But then see at the results. There is no fat grafting. I beloved fat grafting. I really think the first to use fat on the labia majora so many years ago. I beloved it, but in some cases we don't need it, and we need just to improve the skin quality. For tissue regeneration, very interesting. I beloved this chapter. I'm part of the ISPRIS, and I'm the board of I'm the appointed member of ISPRIS for Italy. So I perform lots of regenerative procedures. You know, in fat, you have giant major adipocytes, non-major adipocytes, and then there is a stromal vascular fraction with fibroblast and endothelial cells, and the interstitial fluids with white and red cells. We know that each preparation is different. Stromal vascular fraction, nano, micro, fat graft, and mesenchymal stem cells are different preparation. We know that fat has a mechanical effect, regenerative effect, and it has, especially the stromal vascular fraction, an inflammatory control, immunoregulatory control. And according to the techniques, we may make a division with a mechanical harvesting, ultrasound-assisted harvesting, and laser-assisted harvesting. And according to the dimension of the clusters, we may have bigger clusters or smaller clusters, as in nanofat. So with a BeautiFill system, we have a system where we can harvest the fat and directly collecting into a canister. And as we said, is so gentle on the fat cells that it keep the fat cells intact. And more than that, what happens is that the fibers that are attached to the stromal vascular fraction that is attached to those fibers and are aspirated definitely easier. It's like, as I said, the metaphor of shaking the apple tree. it has been demonstrated by first publication of Levenberg that the quality of the fat is top, hyper top. And then again, we recently performed a study on the quality of a lipoaspirate, and we demonstrated that the quantity and the quality of the stromal vascular fraction inside our fat is high top, is enormous. And those are some data of our study, and in which we demonstrated that the quantity and quality of the stromal vascular fraction in our preparation with a specific system to get the stromal vascular fraction is very similar to the one that we can get with enzymatic system, and that I really think that will change dramatically our way of proceeding with regeneration. Of course, we have to understand the parameters that are very different. If we want just to fat harvest, or we want to fat harvest and obtain some fat. So if you want to skin tight or to fat graft, the pressure has to be low instead of high. This is the canister that we use, and we have to decide which diameter of cannula we will use, and which kind of fiber, because each fiber has a special dimension. So it means that the internal lumen of the cannula will be different. In each case, we will use one fiber or the other. So this is important to understand exactly which kind of preparation and cluster we will get. A fat, a microfat, or even a nanofat. Look at, for example, here, this is a chronic tendon inflammation in a professional tennis player with severe pain, impossible flexion. You see the white here due to cortisone injection. So this is the fat grafting from the abdomen with a small canister. Here I go with low pressure and low energy. Then here the centrifuging of the fat is one of the few cases where I use centrifuging of fat. And the fat then is collected, the fluid is taken out from is removed, and then the fat is moved from 10 cc syringes to 3 cc syringes, and then by under echography, I'm injecting the fat right over the tendon. You see here, this is the surface. This is the tendon. You see, this is the tendon. So you see here my cannula, and under ecography, I'm going right to where I need to inject the proper quantity and quality, proper quantity and quality of fat. You see here my cannula. I go exactly where I need to inject my fat, small quantity. And you see here the result. Look at the color, and he went back to professional sport in 3 months. Stenotic lichen sclerosus. Here I'm harvesting my fat with my the small canister you see here from the inner type. So this is my the fiber, the cannula, and then I collect the fat from my small canister. Look at the quality of the fat that I can inject, how it goes out so fluidly. So important to have a nice and fluid fat to inject. And then I start with my top procedure, because it's the procedure I perform more in mostly in hospital, that is genital fat grafting. So I enter in the fibers, I inject the small quantity, and then I detach the fibers, and exactly as we generally do in radiodermatitis, exactly. So one side and the other side. Then you can see the quality after 1 year, after 2 treatments of fat graft, but it's fantastic. Look. Then, of course, it can be used for vaginal laxity treatment as well. I'm sorry, but I cannot speed up as usual. So this fat graft of the labia majora, I'm inside the labia bag and I'm injecting the labia, and then here I'm doing pretty the same. Labia majora, then I'm moving medially under and above the bulbocavernosus muscle and under the mucosa. Then I really like to do what I call the Milan lip, as once it was the Paris lip. It means that I like very much to detail the vulvar crest, exactly as we do for the lips. So with the 18-gauge needle, I'm right under the skin and over the fascia, and you can detail instead of just giving volume. I detail. And then at the end of the procedures, Femilift CO2 endovaginal treatment to treat the laxity, so that you can do something that is a complete treatment. And you see after one single treatment, the results that are really found incredible. And for regeneration, you can get very interesting results with a BeautiFill system for sclerodermia, for example. Look at here, before and after. You know that in sclerodermia they don't open the mouth. Look at the teeth here. She was not even. It was not even possible to open the mouth. Look at here, the huge benefit she had on the teeth that before she could not have. A monolateral mandible lip hypoplasia, 120 cc's full face. Look at the difference between before and after. Of course, a rhinoplasty as well, but look at this is only fat. No implants, is fat only. Or an Alpert syndrome, 200 cc's, full face, full BeautiFill microfat graft 1 year after the procedure. So very interesting. And I will end up 5 minutes and then I will be finished with BeautiFill for breast. I think it's wonderful as a single procedure for breast augmentation. Very good for breast augmentation after a silicone breast implant removal, or BeautiFill plus breast implant, what we call composite treatments, or at the same time of mastopexy reduction. I will show you some procedures. For example, implant removal. This is a patient who underwent implants, so the removal of the implants, implant removal, perioral mastopexy and fat graft of 320 cc's, 80 cc's submuscular, subcapsular, posterior capsular, subcapsular, anterior capsule, and subdermal. And there she had an augmentation with a 230 cc. So the fat harvesting, we will not stay on that. The removal of the skin, the removal of the implant, then the washing my fat in order to remove the lidocaine. The fat that I'm collecting, and look at the quality of the fat. This I want to point out. Look at how it goes out fluidly with no problem. Then hydrodissection of the submuscular pocket, and I'm performing a submuscular fat grafting. Here I'm opening the pocket. You see, this is the pec major, and this is my hole. So here I'm under the muscle. You see, I'm under the muscle, and I'm injecting the fat under the muscle. And this is the first layer. Then I start with the second layer. Then I start with the second layer, that is the posterior fascia. So under the posterior capsule. And then the third, that is under the anterior fascia and anterior capsule. Sorry, here is written fascia, but it's capsule. And then I end up with a subdermal fat graft, so right under the dermis. So never, never, never inside the gland, never. So this is case 9 months post-op, so it's total stabilization. So it's one stage, 300 cc's multi-layer fat graft. After the removal of 230 cc's implant. Sometimes a selective LAL breast reduction helps a lot. In this case of PEC-C, in a secondary breast reduction, LAL, lateral quadrants and inferior quadrants, and fat graft on the superior quadrants. So I start with the with injection of the saline. Then the selected LAL of a lateral, medial, and inferior quadrants. And after you perform that, what you will see is that you open up the fibers. The fibers are definitely intact, but you reduced enormously the quantity of fat. So due to this, and then, okay, then I will inject fat in the upper quadrants. And I will inject the fat in a triple plane position, so under the muscle, under the gland, and under the dermis in order to have and to achieve a better projection and stable projection of the upper pole. I show you some cases. The implant removal. There's is 300 cc's per side, 3 layers, 1 session, 300 cc after 1 year. Of course, there are some cases where you have to retouch the patient, and fat graft only of the patients is not the best techniques for patients that are like a yo-yo. They gain weight or they lose weight, doesn't work. But for stable patients, I think it's fantastic. Of course, they cannot ask for 2 bra size more, but if their will is of a moderate correction, I think that the technique is fantastic. You see here, if you want to achieve half a bra or a bra, as a single procedure technique, it works very, very well. It's not the technique for those who look for something that is definitely huge. It's not the right technique, but if you select very well the patient, so it's fantastic, even if as a primary technique. And is my favorite in implant removal as well, when the patient, they don't want anymore to have an implant, they want to remove the implant, is perfect. As it is in composite breast augmentation, for example, round implant here. I never liked round implants. I beloved anatomical implants, but with the allergan story, I had to change a little bit my position, and now is around 50 and 50, but adding all the time in the composite the fat graft. So small round implant plus fat graft. And you see here the results with 200 cc's round implant plus 200 cc's of fat graft that I did in a course during the course. And this is another case, 240 cc's plus 150 cc's of fat graft per side because she was too much skinny. And you see that results are very favorable. You cannot get these results with fat only, but with fat, with a small implants, of course you can get. And then of course you play with breasts like those, where you perform a liposuction of the medial and inferior quadrants and mastopexy, and of course you get incredible results. But it's very easy to get results in patients like that, like those where there is a gland that, a breast that is highly with a high percentage of gland, but so it's easy. What I found, and we'll end up with this, well, what I really found interesting is the study that we presented at the ISPRIS in Marseille a year and a half ago. But it was a clinical follow-up plus echography at 4 days after fat grafting, 4 days, 10 days, 1 month, 3 months, and 9 months. And patients were 38 patients, fat grafted 6, breast implant plus fat graft 6, again 9, breast implant removal plus fat graft, and mastopexy plus fat graft 11, breast reduction and upper pole fat graft 6. And you see here that infection 0, seroma, 2 seromas, but were in all concentrated in breast implant removal cases, so it's okay. And in 1 case of breast reduction, cellulitis, but really for a few days in mastopexy and breast reduction, really few days, and then they solve spontaneously. And then we perform an echographic follow-up at 6.4 months of mean time, and we found liponecrosis, a small, really small one in 1 case of fat graft only, and in 2 cases of lal breast reduction. But of course, those are minimal, less than 2 centimeters, but according to radiologists is similar to nothing. So 2 oil cysts, but again, less than 2 centimeters, that are not significant again in 2 cases of breast fat grafting only and LAL, and 1 calcification in a LAL breast reduction. But here again, I don't know if it was due to liposuction or it was due to the medial sutures. And intramuscular injection, yes. I work a lot with echographer, but despite that, and I'm really careful about not injecting inside the muscle, but what we saw it was that we found fat inside the muscle in several cases, in 5 cases. And I didn't expect that. I found that very interesting, and we are studying more about that. It's just something anecdotal and not so important, but I think that is interesting to share with you. So in conclusion, diode laser assisted fat graft for the breast is very promising technique and technology, especially in those days. In which we are talking a lot about breast implant safety. Allergan story was a disaster for us, and there are some news about other implants, such as you said, the extra light breast implants from Israel that were stopped, the production was stopped, the B-light were stopped for the production as well. So this is the moment where to push, I think, our patients to fat graft. So I would like to thank you for the attention, and I hope that was interesting. And if you have any question, please ask me or ask to your distributor to give to you my telephone number or an mail, and it would be a pleasure to deal with you.
Okay, Dr. Brambilla, I thank you very much for your experience with us. I have a question for my doctor from Poland. We have some question. Okay, we have some question for the chat.